And joining us live from our Kano studios to examine this issue further is the Director, Center for Infectious Diseases Research, Bayero University, Kano, Professor Isa Sadiq BUK. Thank you for joining us on the News at 10. I'd like to begin by asking, as an expert in this subject and being a member of the academia, what facts do you have regarding preparations for the resumption of school? And this is in the face of the second wave of COVID-19.
Okay. As an academician as well as a public health physician, I am really concerned about the two things that are before me. Number one, the academic activities, which have been not going in this country for so long, but at the same time, we are facing the second wave of COVID-19, which is a reality. If this resumption were to take place around July last year, one would have said that, okay, we have started noticing a decline in the number of daily cases reported by the NCDC. However, if you look at what is happening across the world now, and in Nigeria specifically, the number of cases being reported, which hitherto was even less than 100, has now climbed to over 1,500 in most of the days. This is saying that the number of cases is rising, and it's like the second wave has taken shape very well in Nigeria. One thing I want us to understand is the fact that the number of daily cases reported is not truly representative of the situation in Nigeria. This is my personal opinion, because most states are having difficulties with the number of tests they conduct on a daily basis. And in fact, that is why the Presidential Task Force on COVID-19 is taking measures to assist the states ramp up their tests. And unless we are able to reach a minimum level of about at least 5% of Nigerians being tested, I do not feel we are at that level where we can confidently say that we are there as far as control is concerned. So now, if we allow a lot of activities such as commercial activities, social activities, and academic activities to take place, there is likelihood of people mixing very well. And if you look at a university, it's like the whole country coming together, because people will be coming from different states and they will come to a place where they will learn. Some of them will be sleeping there. And if you look at the most important problem we are going to be facing is lack of physical distancing. A room that is meant for like 4 students is currently being occupied by up to 12 students because of the issue of squatting and the rest. So physical distancing is not going to be there. And then in the classes, you know that most of our lecture theaters are overpopulated. So it is going to be a source of concern for all the universities to achieve this much desired physical distancing. And that is going to be the greatest challenge. The other issues having to do with hand washing, hand sanitizing, use of face masks, at least they are under the control of the university authorities to enforce them. But the university authority itself cannot guarantee that physical distancing, which is supposed to be its main role in this case. Now,
Professor Sadiq BUK,
and if you look at yes,
I must quickly ask you, because we've run out of time, but if you can answer me in just a sentence, and this is, do you think that it would be logical to open other, perhaps sectors, the markets and every other places, and then shut down schools?
Well, you see, even the other sectors, including commercial sectors, we have to review what is happening and most likely stagger some of the activities. It is not only education sector that we should halt in this country, but other sectors need to be reviewed also, with the aim of reducing population mixing and further transmission of this virus. Definitely we have to take everything, a holistic approach, not only the education sector, but at least the education sector should also be given a good look at, because if we allow everything to take place in the academia, and the youths that are not well affected by serious cases will continue to mix, but the people that will be at the receiving end will be the elderly. Most of the lecturers will be suffering the illnesses, and then some of the other people who do their activities within the university campuses will also suffer. And
essentially, the
youth,
risks are there.
You've
mentioned them. The risks are there, looking at a holistic approach and everything. We'd like to appreciate your time. Thank you so much, Professor Isa Sadiq Abubakar. Thank you for joining us on the News at 10 tonight.
Thank you. Thank you very much.